Good to proceed. Okay. Hello, I'm Heather Granado. I'm the Vice President of Partnerships and Sustainability for Informa Markets Food EMEA, and delighted to have you here as we return to VitaFoods Asia in person. It's wonderful to be here in Bangkok for our first time, co-located with FI Asia. Thank you all for joining us. If you were looking for the Wi-Fi, we do have that. If you go into FI VitaFoods Asia, the password is Bangkok 2022, and you just need to log in, and that'll get you onto the Wi-Fi. We will be taking questions, assuming we have time after our next presentation, but I'm just delighted for our session. Our speaker is Wolf Marks. He's Senior Research Fellow at the Food and Mood Center at Deakin University. And the session, Recent Advances in Diet and Nutraceuticals for Mental Health. We're going to discuss the importance of gut microbiota in mental health and potential role of related nutraceuticals such as polyphenols, probiotics, but much more around the topic. And Wolf, I'm going to turn things over to you.
Okay. Well, I first just want to thank the organizing committee for having me here today. It's first time I've actually been out of the country since 2019, so it's really great to be here and hopefully to meet you all later during the conference. So as introduced, my name is Dr. Wolfgang Marks. I'm a Senior Research Fellow. I head the Nutraceutical Research Stream at the Food and Mood Center at Deakin University in Australia. And I guess as the name suggests, our research platform is where we look at the food that we eat, the nutrients that we consume, and how this affects our mental and brain health. We are a team of about 50 senior research fellows, trial coordinators, research assistants, staff, students, all the rest. And really what we look for, our guiding vision, is a world in which nutrition is recognized as a fundamental to mental and brain health. So not a nice to do, not an add-on, nice to a thing to consider, but something that's foundational and fundamental to mental and brain health. And so what we do to try and enact this in the world is we run a broad research program where we look at right across the lifespan. So starting at early life and pregnancy, all the way over to healthy aging. We run a bench to bedside approach where we look at more mechanistic studies and preclinical animal models, all the way over to clinical trial research, implementation research, translation research, to try and get it into the clinical practice and to educate and to inform the general public about the role of diet in our mental health. We also look across the mental health spectrum, so including the common mental disorders, things like depression, anxiety, also severe and SMI-related conditions, things like schizophrenia, as well as more related conditions, things like stress, mood, fatigue, sleep problems, these sorts of things. And I guess as this is a more industry-facing conference today, I also wanted to highlight that many of our successful trials and programs have been in collaboration with industry partners. Clinical trials in particular through our Express trial program, where we have a package to allow for rapid recruitment with a feasible cost that I'm happy to talk to anyone after this presentation, as well as systematic reviews and rapid reviews, our consulting services due to our microbiome analysis platform, as well as preclinical and animal models for those more emerging compounds that might be of interest that aren't quite ready for that clinical trial phase. So the role of diet in our mental health, so nutritional psychiatry. So this is a relatively young field. The Food and Mood Center, we're really, we started, I think, in 2017, but there's now been a huge amount of research done by us, our collaborators, and researchers all over the world that have examined the role of our diet and nutrients in our mental health. So today, I wanted to talk a little bit about what the evidence says. I'm going to be starting with what the role of dietary interventions and whole of diet interventions first, and then I'll talk, of course, about the role of nutraceutical and individual compounds in psychiatry. So if we start with observational studies where you look at really large data sets and we examine what they're eating and what their risk of mental health is, there's been a number of these observational, both cross-sectional and prospective studies over multiple years that have found an association between an improved diet quality and a lower risk of mental health. And this is a meta-analysis that we conducted with colleagues where we found that higher adherence to a Mediterranean style diet, as well as a more anti-inflammatory style diet, is associated with a reduced risk of approximately around 30% reduced risk in depression. Moving beyond the observational studies, so not only looking at correlational sort of analyses, we also have a number of randomized controlled trials that corroborates this evidence. So this was a meta-analysis that we conducted of randomized controlled trials for dietary interventions compared to control groups. And what we found was that these dietary interventions had a small but significant improvement in depressive symptoms compared to the control group. I think this is really important evidence because, again, we're moving beyond this correlational analysis and we're actually looking at this more causal role of diet in depression. What's also exciting is that we have a number of randomized controlled trials in people with clinical depression as well. So that previous meta-analysis was in people with sub-threshold, undiagnosed levels of depression. Now we're moving into clinical trials in people with clinical depression, so that really severe level of depression. So this was the SMILES trial that we conducted out of the Food and Mood Center. It was in 67 adults with clinical depression. This was a 12-week intervention study. We randomized participants to receive either a Mediterranean-style diet or a social supports kind of control condition. Very briefly, this is the type of diet that we worked with individual participants to improve their adherence to. And really, in essence, all I really want to say here is that we encouraged the intake of foods that had high levels of those bioactive ingredients. So, fish for the omega-3 fatty acids, beans and legumes for that prebiotic fiber, fruits, vegetables, spices for those anti-inflammatory polyphenol compounds. And at the end of that 12-week intervention, while both groups decreased their levels of depressive symptoms to some extent, you can obviously see from this slide that the people that received the dietary intervention had this significant reduction in depressive symptoms, so much so that at 12 weeks, 32% of those in the dietary group achieved remission criteria, which was quite remarkable at the time. This is the first trial that to ever sort of formally investigate the role of dietary intervention for depression. What's really exciting to see is that there are now a number of studies from independent research groups that have replicated our findings. And so this has been really a great thing to see. And what's happening now is that there are a number of international and national guidelines that are now considering dietary interventions along with other lifestyle interventions as a core component to mental health. So over in Australia, our recent mood disorder psychiatry guidelines actually say that diet as well as other lifestyle interventions are foundational, quote unquote, to the management of mood disorders. The recent report from the WHO also identify unhealthy diets as a key risk factor for risk of mental health, mental illness. So that's the role of what we know so far around the role of dietary interventions and whole of diet interventions for our mental health. That was very much a snapshot, but what I want to spend some time on is the role of nutraceutical compounds. Because while we know that dietary interventions and having a healthy diet is very important, as I've shown, to our mental health, but obviously for our physical health as well, nutraceuticals offer a number of unique benefits, particularly in the mental health space around adherence issues, ensuring that there's a consistent level of a therapeutic dose that's being able to given to people with mental illness, and they're also widely accessible. So what I want to do is spend some time talking about the work they've been doing to investigate the evidence for various nutraceuticals across the mental health spectrum. So what I want to start with is the role of nutrient supplementation. So by that I mean minerals, vitamins, amino acids, omega-3 fatty acids, and later on in the presentation, I'll talk about more of those phytoceutical compounds, so those more plant-based and herbal formulations. And so to start, I want to talk about a publication where we published in World Psychiatry, which is the leading journal in psychiatry, where we conducted a meta-review, where we looked at that top-tier evidence, that meta-analytic evidence. And to do that, we identified 33 meta-analyses of placebo-controlled, randomized controlled trials, which included over 10,000 participants. If we start with major depressive disorder, because we looked across the spectrum of mental disorders, we found that there are a number of nutraceutical compounds with that top tier level of evidence supporting their use in depression. Omega-3 fatty acids had the highest level of evidence, and by that I mean they had the highest level of clinical studies per meta-analysis. So I'm not sure if you're able to see, but at least on the, if you look, let's see if well, it doesn't matter. Essentially, it had the highest number of randomized controlled trials compared to some of the other nutraceutical compounds. What's also interesting about the role of omega-3 fatty acids is that if you looked at the high EPA formulations, the formulations that had that high eicosapentaenoic acid, those had a significant improvement in those depressive symptoms. However, when we looked at those that had high DHA formulations, they didn't show that same sort of benefit. So that suggests that the EPA in particular might be a particularly powerful ingredient in omega-3 fatty acids for major depressive disorder. We also found a number of top-tier evidence for various other nutraceuticals, particularly high-dose methylfolate, vitamin D, zinc, and acetylcysteine. And I will mention that for vitamin D, we've recently published an updated meta-analysis that looked at a number of additional clinical trials that have been conducted since the publication of this manuscript, and this essentially corroborates the evidence that's been shown in our original meta-review. Now, if we move beyond depression to some of the other mental disorders, the level of evidence really tends to drop off in terms of the number of individual clinical trials that have been conducted for these various mental disorders. So this was a systematic review that we conducted for the use of nutraceuticals in bipolar disorder. And while we found a various number of individual clinical trials, what we found was that there were of relatively small sample sizes, relatively limited studies per a nutraceutical intervention. Where there were more than one, there was sometimes mixed results, all indicating that there are more studies are required to investigate this. And if we go back to our original meta-review, this really sort of corroborates what we found in our original systematic review, in that there were a much lower number of nutraceutical compounds that we found that sort of top tier evidence. And from that, it was really N-acetylcysteine that was showing the greatest signal of an effect. If we go on to anxiety disorders, and again, this is for people with clinical diagnosis of anxiety disorders rather than general anxiety symptoms, we see that the evidence for nutrient supplementation is even lower, where there's very little evidence that we could find of that top tier randomized controlled trial evidence. And from that, there was relatively low levels of an effect. Now, if we move on to the more plant-based, so phytoceuticals, the role of herbal and plant-based formulations, we also conducted a same style of meta-review where we looked at that top-tier evidence, looking at 9 meta-analyses of randomized controlled trials, including just under 6,000 individuals. And from that, if we break this down, because this is a little bit of a messy slide, there we go. If we start with the major depressive disorder, we found that curcumin, St. John's wort, saffron all showed significant improvements in major depressive or depressive symptoms. St. John's wort in particular had a high level of randomized controlled trials compared to the other more emerging nutraceuticals. If we looked at saffron, if we looked at anxiety, we saw that kava didn't really show much of an effect, but saffron showed a significant improvement in anxiety symptoms according to the meta-analyses of randomized controlled trials that we identified. And then if we looked at schizophrenia, we only found one intervention, that was ginkgo biloba, which improved a number of various symptoms for schizophrenia. And I think that's actually quite an interesting finding, because schizophrenia can be quite treatment resistant. It's quite hard to, move the dial with a number of various approaches. So to see that ginkgo biloba seems to be helping for a variety of symptoms is quite an interesting result. Now, recently, and by recently, I mean really kind of a couple of months old, we published an international set of clinical guidelines for the use of nutraceuticals in psychiatry. And so this is a great time to be presenting to you today, because, it's really only the last couple of months that this has been out. This was really a huge amount of work. It was about 2 years worth of meetings and data analysis and all these sorts of things. But we essentially used a system where we looked at the evidence that was included in our meta reviews. We then conducted a series of additional systematic reviews to identify any additional randomized controlled trials that have been conducted since the publication of those meta reviews, to inform the evidence base, but we also looked at the sort of acceptability in the clinical setting. So things like safety concerns, legal and a cost-benefit analysis, these sorts of things to derive a set of recommendations for a variety of different nutraceuticals across the mental health spectrum. And so as you can see from this slide, we identified a number of nutraceutical compounds and provided a series of recommendations across this spectrum. In green are the ones where we provided where we provided recommendations of various levels. So from a high level, strong recommendation to relatively weak recommendations. In that sort of purple color, this is where we were unable to provide recommendations either way. This was largely because of just a lack of clinical trials or a mixed evidence base between the various clinical trials. So essentially, we're not saying that they don't work. It's just that we need some more evidence for these particular interventions. And then for the ones in red, again, this is for clinical diagnosis of that really severe mental health level. We provided recommendations against their use purely from a lack of where there's been clinical trials that have shown them not to be effective in that space. This is a little excerpt of what we include for the various nutraceutical interventions in our guidelines. So it provides a recommendation statement based on the strength of the evidence, our evidence grade, so we can so you can see what that recommendation was based on. And then we also provide a clinical guideline statement. So this is a variety of different considerations that the physician, the clinician working with patients can help guide their clinical practice. So in summary to that section, essentially the evidence at the moment and the work that we've done in the space demonstrate that there are several nutraceutical interventions that can be indicated for a variety of mental illness and mental disorders. Most nutraceuticals are well tolerated with very low safety considerations. Omega-3 fatty acids, methylfolate, St. John's wort, amongst many others, show the greatest efficacy. But we really need some more studies in this area, particularly for mental illnesses other than depression, where they've been relatively underexplored. And we also need more studies for those more emerging nutraceuticals. There are a whole host of nutraceuticals that are probably around in these booths where there's been, maybe one or two good quality intervention studies, but there just isn't that level where we can provide that high level meta-analytic synthesis. So what's next? What, at least do we see within the Food and Mood Center, as some of the more emerging concepts, some of the more emerging interventions that we're prioritizing and that we're investing our time in? Well, the first one is the role of polyphenols. If you're not familiar with that term, they're essentially bioactive compounds, phytochemicals that are found in fruits, vegetables, spices, teas. The reason why blueberries are blue are because of these pigments, these polyphenol compounds. And what we're finding right now that there are a whole host of observational studies as well as emerging intervention studies that show that these might be promising interventions for mental and brain health. There's also a whole host of interesting mechanistic data that show that polyphenol compounds interact with a variety of different pathways that are implicated in our mental health. Particularly among those are the strong prebiotic properties of polyphenols and their modulation of the gut microbiome. Speaking of which, we're also very interested in the role of probiotics, particularly for depression as well as other mood disorders. This was a meta-analysis that was conducted in 2019 by other colleagues that looked at the use of probiotics for depressive symptoms as well as anxiety symptoms. And as you can see from the circled thing down at the bottom of the slide, we can see that they improved both depressive symptoms and anxiety symptoms. But right now, we don't have a great understanding of the optimal dose, the optimal strain, the optimal delivery. Is it a single strain that is more effective, or is it a more multi-strain approach? There are all these unanswered questions, and there are also a number of emerging proprietary blends that I think quite likely might provide a greater support compared to some of these more generic strains, but these are all relatively unexplored questions at the moment. We're also very interested in who responds to treatment. So we know that the same nutraceutical intervention for two different people, you might have a very different response. There are all sorts of baseline factors, our inflammatory system, our microbiome composition, our background diet, physical activity, all these things can influence our treatment response. So exploring what works best for who is a key question in this area. We're also very interested in the synergy or potential synergy between different ingredients. So many of these nutraceutical interventions have been studied as standalone interventions. But what happens if we combine, say, an anti-inflammatory fish oil with a prebiotic and a probiotic, looking at various different pathways that provide some sort of synergy? These are relatively unanswered questions now, but I think is a really useful and potentially beneficial area of future research. And we're also very interested in novel delivery methods, particularly for people with mental health problems where, adherence is an issue, where, motivation is an issue, where there are socioeconomic considerations, things that can make it easier for people to consume and to improve their bioavailability while needing less capsules or making it easier for them to take is all very useful in terms of feasibility of these products and to improve the acceptance. And very briefly, this is just an example of a clinical trial that we're working with industry partners that I think kind of ties together a lot of those various factors. So this is in 40 women. We're looking at a probiotic drink. And we're not only looking at mood and cognitive outcomes, but we're also looking at brain imaging. So does it change the structure of the brain? We're also looking at the microbiome and the various metabolites that are linked to that. I can see my time's up, so I'll quickly just say we have a conference that I'm happy to talk to you about later after the slides. And if you're interested in knowing more, please visit us at our website, my Twitter, my email, and I'll also be here for the rest of the conference. Thank you very much.
I was so fascinated. I was like, oh, he's got all the time in the world. I think we could take one quick question. We've got time. Okay.
It's a very good presentation. Thank you very much. Got a quick question. Do you know how's the interaction between the nutraceuticals with the standard treatment?
Excellent question. So that's really a case-by-case basis. So and it all depends on the mechanisms of action of that various nutraceutical. So I guess the classic example is St. John's wort, where it has that strong serotonergic, but also that the interaction with the liver enzymes, where there is that high risk of serotonin syndrome if it's combined with standard SSRIs. But then there are various other nutraceutical compounds that might act through, the gut microbiome or, various inflammatory pathways like N-acetylcysteine that don't have the contraindication. And so it's really just a relatively case-by-case thing.
Well, thank you again so much, Dr. Marks, for being here. And certainly, will you be around if folks have other questions for
Absolutely.
you?
I'll be here all day and for the rest of the conference. So
Wonderful.
please feel free to chat with me.
Thank you so much. Our next session will start here at 12:30.
Thank you.